Good morning, my dear students. I hope we are just back to our class to Herbal Drug Technology. Today we are going to have some discussion about our traditional medicine practice. There are many like Ayurveda, Siddha, Unani, and even traditional practice. We have many internationally. We have many African medicines are there, indigenous medicines. There are even Chinese, and even there are many practices, cryo practice, and there are many practices, Reiki therapy, and there are many practices are there. But today we are going to see our specifically we want to discuss about Ayurveda. We want to see other systems also, but we will see about Ayurveda system, not just an outline, just a small details which you might have come across in previous semesters also. Even in pharmacognosy, you might have got this some detail in the previous fourth sem, or I hope according to the syllabus. So now we in this unit 2, the basic principle involved in Ayurveda, Siddha, Unani and homeopathy, and we have to have some discussion about preparation and standardization of Ayurvedic formulation, with some emphasis in Arista, Aswa, Gutika, Churana, Lehya and Basma. We cannot go within an hour, but still we will continue with 2-3 classes. In today's class, we are just dealing with the principle of Ayurveda, the principles behind Ayurveda, which I think it is our traditional medicine, which has lost lot of impact and lot of history. It was in traditional, very old traditional medicine of India, and it has own pharmacopoeia, it has own various preparation, it has own special treatments, and more positive in the whole world. And people are now, if you see in Arab, most of the people are using Ayurvedic treatments, and even in Europe and in America, all are now depending on herbal drugs and for their treatment and for various ailments. So we have to know about what is its importance and how it is spread over the world, and we should also give some importance, and if we know, we will be getting attached to them. It's normal life we are using this traditional medicine practice, especially Ayurveda have more detailed practice, which has now officially, we have courses BAMS, BSMS, BUMS and BIM previously, but now we have separately for every traditional medicine practice, and it was having more emphasis and as well as more application in various difficult ailments. Even they had a more positive sense in giving cure from even the present era of corona, and this COVID-19 is also have been treated with various herbal drugs, and their immune power of various patients have been approved and also proved by many treatments. So according to Ayurveda, to Ayurvedic philosophy, an individual bundle of spirit desirous of expressing itself uses subjective consciousness or sattva to manifest sense organ and mind. Spirit and mind then project themselves into a physical body created from the 5 Panja, that means Panja, great Maha, that means Panja Maha, eternal elements, Buddhas. That's why it's called Panja Maha Buddhas, which arises from tamas. The sense organ then using rajas to project from the body into the external world to experience their objects. The body becoming the mind's vehicle. The body becoming mind's vehicle. It's physical instrument of sense. Physical instrument for sense gratification. What a word, what a sentence. Just go through it. The Bhutas combine into tridosas or bioenergetic forces that govern and determine our health and physical condition. While the three gunas, rajas are activity, tamas are inertia, sattva which balances the two, that means the activity and inertia or rajas and tamas have been balanced by sattva. So Ayurveda is thus a holistic system of health care that teaches us to balance these energies in order to achieve optimum health and well-being. According to Ayurveda, three bodily humerus or dosas makes up an individual. The health of an individual depends on the balance between dosas or bodily humors called Kava, Pitta, Vada, tridosas. What are they? Kava, Pitta, Vada, the tridosas. According to Ayurveda, the three bodily humors or dosas make up an individual. The health of an individual depends on the balance between the dosas or bodily humors called Kava, Pitta, Vada, tridosas. While Vada dosa mobilizes the function of the nervous system, Pitta dosa plays a key role in digestive by using bile, and thus bile to direct digestion and improves blood circulation, and Kava dosa is related to lubrication, mucus and carrying of nutrients into the arterial system. See how the three of them are having their activity. Ayurveda works on the fundamental concept of tridosas to have a deeper understanding of Ayurveda and its benefits. It is important to understand the tridosas. So if you see this picture, it's just a chart what we have discussed. That is Vada, Pitta, Kava, tridosas. So space and air is connected with Vada, and rajas, sick, and which is then we can see catabolic, activating and dynamic. These all are the activity. And fire and water is Pitta, where sattvic or sattvic, metabolism, balancing and transformative. Kava is also dealing with water and earth. That is Prithivi. Earth means Prithivi, water means Jala, fire means we can say Tejas, and air means Vayu, space means Akash. And in Kava you can see water and earth together, Tamas, that is Tamasic, you can say Tamas. and anabolic, conserving, stabilizing. This is what this chart will give you the idea. And now we are going to detail with a small explanation for the Panchamahabhutas. That because Panchamahabhutas, according to Ayurveda, everything in life is composed of Panchamahabhutas. What are they? Panchamahabhutas. They are Akash, Vayu, Akash space, Vayu air, Jal water, Agni fire, and Prithvi earth. Omnipresent, they are mixed in an infinite variety of relative proportions, such that each form of matter is distinctly unique. Although each element has a range of attributes, only some get evident in particular situations. Constantly changing and interacting with each other, they create a situation of dynamic flux that keeps the world going. Within a single living cell, for example, the earth element predominates by giving structure to the cell. So the water element is present in the cytoplasm of the cell or the liquid within the cell membrane. And you see, the fire element regulates the metabolism process, regulating that cell, while the air element predominates the gas therein. The space occupied by the cell, in the body denotes the last of the elements. In case of a complex, multicellular organism like human being, for instance, Akash corresponds to the space within the body, mouth, nostrils, abdomen. There are various spaces are available. Vayu denotes the movement, essentially muscular movements. Agni, fire, Agni, controls the function of enzyme, intelligence, digestive system, metabolism. Jal, water. As in all body fluid as plasma, saliva, digestive juices, and Prithvi, the earth, manifests itself in the solid structure of the body, bones, teeth, flesh, hair, everything. So the Panchamahabhutas therefore serves as the fundamental of all diagnosis and treatment modalities in Ayurveda, and has served as a most valuable theory for physicians to detect and treat illnesses of the body and the mind successfully. So they are treating the mind and the body, which will give complete peace and relief from the ailment. With an ailment, when a patient comes to the Ayurvedic doctor or a traditional medicine practitioner of India. So see, these are some of the charts which I have denoted, some points how they will diagnose and give the treatment for various ailments according to the principle of Ayurveda. So you can see it is different. Panchabhutas have given all the 5, and sense organ where it is denoted, and sensory faculty where it is connected, and properties and what is its action. So when you talk about the space, we are telling about ear, mouth, this all comes. Ear means, just an example, hearing creates natural void in the body, no distinct taste, produce softness, lightness and porosity. And when you come to the air, it denotes the sense organ, skin, touching, feeling, properties light, clear and dry, governs inhalation, exhalation, opening and closing of eyelids, extension and contraction of joints, locomotion and other motor function, slightly bitter taste. Action creates dryness, lightness and emaciation. Emaciation is defined as extreme weight loss and thinness due to loss of subcutaneous fat and muscles throughout the body. So you see how we can diagnose, how we can observe the patient when he comes to the clinic. And the next Panchabhuta is fire. In fire, eyes are fire. That is visual sight. Rough, bright eyes controls temperature and luster, the properties of the body, color and pungent taste. And action helps in digestion, maturation, improves eyesight. And earth is the next Panchabhuta. Earth, solid form, nose, smelling, heavy, mobile, compact, rough, controls organ as teeth, nail, flesh, skin, tendons, muscle, sweet taste. Increases, what is it? For example, action increases firmness, strength of the body, acts as a nutrient, emollient and purgative. And the last one, you can see the water, jal, the Panchabhutas, water, tongue, taste, cold, heavy fluid, slimy, fat and sweat by nature, sweet, astringent, sour and saline taste. Its action imparts glossiness, enhances fluid content, purgative, acts as nutrient, emollient and purgative. These are some of the characters which we have denoted for the 3, an example only. The 3 are not the 5 Panchabhutas. And what do you mean by Vada? Vada, Pitta, Kava. That means Vada is one of the 3 dosas in Ayurveda that we have already discussed. Energetic force of nature that compose the universe and everything in it. This particular dosa corresponds with the elements of air and ether space. The airy and the mobile qualities of Vada plays an integral part in healthy bodily function such as digestion, the flow of breath and communication between the mind and the nervous system. Vada types tend to have creative personalities and are often inquisitive in nature. Excess Vada can cause the body, mind and emotion to feel scattered like the wind. Scattered like the wind. Excess vada can cause the body and the mind and emotion to feel scattered like the wind. This type of imbalance can happen to anyone, regardless of their Ayurvedic constitution or body type. So these all are one of the parameters, one of the main basic parameters how they will diagnose. We are not going in detail, we are just giving a brief idea about Ayurveda. Ayurveda is known as Ashtanga. Ayurveda means they are called as Ashtanga because they have 8 parts, 8 branches, 8 different branches. That's why Ashtanga Ayurveda, they can be known as Ashtanga Ayurveda. And the 8 major divisions of Ayurveda are given below as follows. Kaya Sikitsha. Kaya Sikitsha is internal medicine. When we talk about internal medicine in Ayurveda, Kaya Sikitsha, which comes almost internal medicine, which is coming with all the other treatments and many other. The physician, what you talk about in allopathic medicine, here also the physicians, they used to have almost all of them the diagnostic treatments in internal medicine. And Kumar Britya, that means pediatric medicine for child in Ayurveda. Bhutta Vidya or Bhuta Vidya is psychiatry, antipsychotic. There is psychiatric treatment. Bhuta Vidya, Bhuta Vidya, Bhuta Vidya you can say. Salakya is otorhinolaryngology. Otorhinolaryngology and ophthalmology. Salya is surgery. And Agada Tandra. Agada Tandra is toxicology. Toxicity, study of toxicity. Many metals, heavy metals and many things are there about toxicity study in Ayurveda. That is Agada Tandra. Rasayana is Geantrics. Geantrics, we can say study about the old aged people or aged patients or aged human beings above the age, undergoing study in the various parameters and giving the doses, differences and treatments. That's called Rasayana. And Vijikarma or Vajikarma, sorry, not Vijikarma, Vajikarma or Karama, you can say Vajikarama, is study about aphrodisiacs and eugenics. Aphrodisiac, there are certain drugs which we are studying, very herbs which are studying for increasing the sexual activities and treatment for impotency and many treatments and also activities of the sexual action can be improved. That improvements can be done by aphrodisiacs. This is special branch. And also eugenics means how the reproductive studies, and what all the different types of complications can also be solved and study is called eugenics. These all are having a branch that is called Vajikarana, not Karama, Vajikarana or Vajikarana you can say. I told Karana it is, okay. And next is preparation of Arista and Aswa. We are just going to the preparation of Arista and Aswa. The method and uses. Aswas and Aristas are medicinal preparation made by soaking the drugs either in powder form or in the form of decoction, kasaya, in a solution, of jaggery or a sugar for a specified period of time. During this process, fermentation takes place and alcohol is generated and facilitates the extraction of active principles contained in the drugs. The alcohol so generated also serves as a preservative. So the aim is the alcohol can extract other constituents by means, and also it can act as a preservative for the particular preparation. So it's a natural way they are using preservation. And it is a picture which is just to denote you, to show you their instruments and their normal in the home. They used to use this type of preparations, like you can see there is a mortar and pestle, a metal mortar and pestle, and a clay pot which is used usually for fermentation, and in home we used to use for various to carry pickles, and very storage of materials can be done very coolly. And also you can see there is some cloth and a bag which is used for, that is all for hot fermentation, for any type of swelling or any type of inflammations can be given treatment by means of Ayurveda. This is picture shows. And also they have some syrups, and there are many aristas and aswas. Today we are going to see only arista and aswa. There are many other preparations, or also we have to undergo how they are prepared and how they are standardized. And this is some picture which can show there is a vessels which they are using for the preparation of Ayurveda preparation. You see there is a man who is just having a big vessel, a pan which is very common excuse me and the pan which is used, and which is a very big spade, he was using for stirring it, which we have used in various marriage functions or big functions which we are having. For preparation we used to use this type of, they are called as varpu, and sometimes they used to call uruli. These all are the names which we are using. This is pots which is for fermentation. Even it can be kept under the soil as we have shown, so that to maintain the temperature for fermentation, and so that it can be taken for where various preparations can be kept for a long time by tying with the cloth, and the natural jute system can be followed for tying them. And you can see that preparation, method of preparation of preparation, when you see arista, the drug is coarse powder and kasaya is prepared, and kasaya is strained and kept in fermentation vessel. Sugar, jaggery or honey as required is dissolved, boiled and added. The mouth of the vessel is covered as we shown in the picture with an earth lid, and edges sealed with clay, smear, cloth, wound in 7 consecutive layer. You can see that it is 7 consecutive layer. It is wound with cloth, and they will make it 7 consecutive layers. A constant temperature is maintained for fermentation by keeping the containers either in a special room, in an underground cellar, or in a heap of paddy. Sometimes underground they used to use, or they will keep in one place, and the paddy will be covered to maintain the temperature. Even for paddy covering also I have kept one picture. After a specified period, the lid is removed and the constant examined to ascertain whether fermentation has been completed. The liquid, the fluid is first decanted and then strained after 2 to 3 days. When the fine suspended particles settle down, it is strained and bottled and packed and labeled. This is what the procedure for arista. You see the picture, traditional practitioner is a manufacturer of traditional practice of Ayurveda preparation. You can see there are many jars of mud pots and a large jar which is covered with a lid and covered with cloth and tied, he has kept for fermentation for preparation of Abhyrista. So this is one picture to show you, and this is underground cellar. We have told sometimes underground. You can see the how lengthy pot you can keep it in underground like what we have shown in the picture, and tie it with the cloth, and you can even clay can be used or jute can be used for tying and closing them. And the temperature can be maintained by paddy, that means about the hay. You can see here, you can see my cursor which I am showing here. This is the yellow color picture where you can see that a heap of paddy or a heap of the paddy field, we have kept a heap of hay over that, and fermentation is done by means of maintaining the temperature. Is also possible by this means. And this is an ancient African fermenter technique. This also they are using the same long pedestal, like long, very long. You can see the picture, very long with the mud lid, and they will be filled with all the products, jaggery and the drugs and everything, and the fermentation kept for is a room which is specified for the fermentation to maintain the temperature and to develop the extracts of the constituents, and Abhyrista can be prepared by this way. So that is what we have seen here the picture, and you see now we are coming to the aswa. Preparation of aswa, the jaggery of the sugar is dissolved in the required quantity of water, boiled and cooled. This is poured into fermentation vessel. Fine powder of the drug is added in the container, which is covered with the lid, and edges have been sealed with clay smear cloth wound in the 7 consecutive layer as we did in Abhyrista. A constant temperature is maintained for fermentation by keeping the container either in a special room, in an underground cellular, or in a heap of paddy. After a specified period, the lid is removed and the contents examined to ascertain whether fermentation have been completed. The fluid is first decanted and then strained. After 2 or 3 days, when the fine suspension particles settle down, it is strained and then bottled and sealed, and then you can labeled and you can finish the product for the ready for the sales. So you see, these all are some of the difference. What is the difference? You can see in preparation of aswa, the jaggery and the sugar is dissolved in a required quantity of the water and boiled and cooled. This is poured in a fermentation vessel. And you see here the drug is coarsely powdered and a kashaya is prepared. And the kashaya is strained and kept in a fermentation vessel. Sugar, jaggery or honey and required are dissolved and boiled and added. And the mouth of the vessel is covered as usual for aswa and Abhyrista. So there is a slight difference in both of them, that both of them are alcoholic preparation. That is why we are telling about aswa and Abhyrista. So this is somewhat precautions. The filtered aswa or Abhyrista should be clear without froth. They should not have any froth at the top. It should not be sour taste after preparation. The preparation has the characteristic aromatic alcoholic odor. Storage, they should be stored in well closed, bottled and in a jar. It should be sealed properly like a cork. And example, there are many Arista, many Aswas are there, but I have taken little example. Arista, I have taken a few example. I think Arista and Aswa, I have given example. In Aswa, I have taken example Aravindaswa, Kumaraswa, and Vasakaswa. Arista, there is example like Abhyrista and Balarista, and Dasamularista is very famous Arista, and Vidyagarista. So, or Vidangarista, you can say Vidyagarista also is a famous Arista which is available. So, now what we have to do is, I have given some listed out this Arista, some formulations which is also needed for you to know, and their standardization procedures and everything we have to undergo. But that, for example, I have added some of the Arista now. So, Aravind Arista, I have given it is an Ayurvedic medicinal use for the treatment of several health problems in the children over health, such as improving the digestion, mental growth and development, physical strength, poor appetite can be solved, anorexia, intestinal gas and abdominal disorder and rickets. There are many. I have added even the constituents which were present in Aravind Arista. And Kumaraswa, I have added, and I have added what is the main use of Kumaraswa, health problem in UTI problems it can be used, and what all the constituents, especially what all the constituents, Mystica fragrance, Terminalia, Balaristam, and honey, jaggery, aloe vera juice and Mystica fragrance. And so you should know what is the main Terminalia chabula means. It is an Jadika, which is very, very common drug which is very commonly used for various ailments. They are using Aswa preparation by means of using all these constituents. And Vasarista is also there. Vasaka is one of the main plant which is a leaf which were very commonly used for bronchitis, asthma, and it has more cough also. We can use it for chest congestion, cough, hemophytic and phytis and laryngitis are also can be treated by means of Vasaka Arista. Vasaka Aswa is also there. And I have added some of the ingredients of the Ada Toda. Vasika is the main constituents, and what is the preparation of Vasaka is also I have added in the slide. You have to know about the preparations. And when you come to Abhyrista is also, I have taken Abhyrista as an example. It is also healing for digestive ailments, very gastric problem, bloating and constipation, hemorrhoids. Treatment can be given for Abhyrista. And its ingredients, I have given various ingredients, especially it has Terminalia chabula is the main constituents. Apart from that, it has many roots and stems, and fruits are also, dried fruits are also, Forniculum vulgare is also added. For these all the ingredients I have given. And Balaristam or Balarista is also one of the important Arista, and there are many Arista. I have taken only 5 or 4 Aristam for you to study. They are also very much for brain, nerve and muscle. It is used for your memory, and so it has many constituents which can improve even digestive, liver functions can also be improved by Balaristam. And it contains various composition, clove, and also which we have studied Bala, that is Siddha cardifolia and woodfolia fructosa, and it has even Rhinus communis, that means castor oil plant. It is also added the extraction, and elachi cardamom is also added. Many constituents are there. Dasamularistam is very, very famous. Dasamularistam is also Dasamularistam is very commonly, it is also having Ayurvedic liquid medicine used in health tonic and pain reliever. It contains 3 to 7% of self-generating alcohol. Because of its preparation throughout the fermentation of the herb, it provides a vitality and reduce weakness, and it is also very beneficial for women disorders. Helps women to keep optimum health. In women, it is commonly used for delivery, for the prevention of post postpartum problems including infection disease of uterus, bladder and kidney, and backache, fatigue, pain and perineal area, and excess discharge, postpartum dispersion and slugging, uterus swelling, breast, etc. can be given as this Balaristam. It also provides strength to the muscle, bone and ligaments and improves immunity. Due to this reason, it becomes famous for women in India, and it becomes a common remedy for postpartum problems. The constituents you can see, that is agli marmillus, that is belva roots, gold apple tree and primala, integrifolia, oroxylum, indigum, and it has many constituents and many roots. Especially we are using it. Solanum, that means solanum, xanthocarpum is also used, that is candrakari root is also common name which we can easily found out. Many constituents, not single constituent. Plumbago xylonicum is also present. Acacia catechu, that is catechu is also as a tannin. Glycyrrhiza glabra is used for sweetening agent. Terminalia Balaristam in the trial, that is Tripura. Suranam is also Terminalia Chabula, and Terminalia Balaristam is also added to this component of this. Dashamulla aristum is one of the famous for postpartum women after delivery. So it has many constituents. The listed of constituents, even cucumber langa is also added, and there are many. Cinnamon xylonicum is also present. A list of products are there, and I have made some of the list of products which is just to go through and to have the idea about examples have to be mentioned. Suppose if you are writing products. In the next class, we have to come across all the other formulation which is available in the Ayurveda, and also we have to go through some of the other systems followed in India like Siddha, Unani, and even we have homeopathy is also another system of medicine, how they are following, what is their preparations and standardization we have to go through in a brief manner. But Ayurveda is one of the famous treatment which is available in India for us, and so that we have Ayush which include, that is Ayurveda, Unani, Siddha, Yoga, and everything is included in that. So that is why in homeopathy, so that's why we are just studying all this traditional system in this herbal drug technology. Thank you for being with me, and we'll see in the next class.